Hi, everyone. Welcome, and thank you all for joining us at this, early or late hour, kind of depending where you guys are coming from. But for those of you who I recognize most of the names, most of the faces, but some people we don't. I'm Dr. Noah Lebowitz, and this is Dr. Michael Lebowitz. So it's great to see a lot of familiar names, faces, and everyone else that made it today. What we have planned today, it's going to be somewhat informal. We have some different things we wanted to talk about, different sources, stories, treatments, just a lot of different things about heavy metals and what we've seen over the years of treatment. And we're going to be talking all about that today. If you guys have any questions, the best way to ask any questions is to type them in the chat bar, and then we'd be happy to get them. Or you can always email us and we'd be happy to talk to you later. We are recording this, so we hope to put it on our YouTube channel later. So if you have to leave early or want to rewatch anything, I'll send out an email later with how to access it and view it. So if you guys want to rewatch anything, please feel free. But otherwise, like I said, if you have any questions, best way, just type it in the chat bar and then we'll get to it as soon as I can. But otherwise, I'm going to let my dad, Dr. Michael Lebowitz, start.
Yeah, we could fill up the whole time with just stories, but we'll just probably give you some of the more interesting ones just to give you an idea. I mean, I've been treating metals since the early 1980s, and a lot of it started with my own horror story. Back in chiropractic school in the 70s, they started talking about the damage that mercury could do, especially in the form of amalgam fillings. So I decided, okay, I'm going to go to the one more naturally oriented dentist in town. I was living in Portland, Oregon, and have my amalgams taken out. So I had them taken out. This was probably 1979. Back then, the composites weren't very good. So I think I had about 13 taken out. And they put in 13 composites. And within the next year, all of the composites started cracking because, again, the quality wasn't very good. So what they did was they took all the composites out and they put amalgams back in. And then about 2 years later, I went to a dentist who was trained by Hal Huggins, who was considered kind of the guru of amalgam removal, and had them taken out again, all in one day. And ever since then, I've had neurologic issues. In the beginning, my cognitive ability was very impaired. My memory wasn't there. I was very nasty. It just, everything was going wrong. I developed a sensation of numbness that went basically through the whole left half of my body. I still have a little bit of residual there. So I got really interested in what to do. And we're trying all kinds of stuff. We're trying all kinds of supplements, sauna therapy, did a Hubbard protocol, which is a sauna with niacin and some fatty acids and so forth. Eventually got decent. And I started treating people. To give you just a real quick few case histories, we had a patient, this actually preceded this. This was when we were living in West Virginia, and he was in his 50s, and he was diagnosed medically as an Alzheimer's patient. His memory just wasn't there. He really used to love to teach Bible study at his church, and he hadn't been able to do it for years. And we had done some testing. We'll talk about what the best tests are and so forth. We'd done some testing, and we found that aluminum was very important in his case. I don't have the records. I don't know what else we did other than do some things to chelate out the aluminum. And within a couple of weeks, he was teaching Bible studies, and his memory was just totally restored. I mean, this doesn't happen every time, but it was interesting. We had another case in West Virginia, and a man was just really stiff. And I told him to, let's see you touch your toes. And he got down, the tips of his fingers barely reached his knees. And we were doing some testing and we found that cadmium was probably the most critical metal for him. There was a lot of cadmium in water pipes back there because they would use it in the solder, and they would solder the galvanized pipe with cadmium-based solder. And we actually gave him copper to chelate out the cadmium, which we'll talk about that later. And when he came back in 2 weeks, he could put his palms on the floor. Probably my favorite case, back when we lived in Colorado in a town called Cedar Edge, we used to take inpatients. I don't do it anymore, and I could go into why, but it's not worth it. And we had a girl who was 13 years old. She was a missionary's daughter, grew up in the Philippines, ate lots of fish a couple of times a day. And when she came to see me, she was averaging 13 seizures a day. And again, we found that metals were really primary for her. We did a combination of supplementation, some sauna, some other things, and they stayed with us somewhere in the 2-week range. By the time she left, she was seizure-free and hasn't had any in the last 25 years. And then we had another case where we had a plumber come in, and he was numb from the waist down. Basically, you could stick a pin in his leg, you wouldn't feel it. And we found that copper was really primary for him. I don't remember what we gave him. And he'd had it for a couple of years. And when he came back 2 or 3 weeks later, the numbness was gone. Again, very quickly responding cases, which isn't necessarily the norm. But just to give you some ideas of what can sometimes happen when you're treating metals.
Okay, so we have some questions coming in, and we will be getting to them when we get to some appropriate places. We've had some good questions. I'm just kind of writing those down, and we will get to them. So if we don't answer them right away, we'll get to them. So when you take a case history, what are some of the types of things that you ask or might get your mind thinking that this person might be a heavy metal case or heavy metals are an issue?
I tend to take very extensive case histories, and I'm always looking in the case histories for possible mold or fungal symptoms and possible metal symptoms and everything else. I mean, whatever the patient says can give you some clues. But if I'm thinking for some reason that this patient might have metal issues, I'll ask them questions like, do they drool at night? Even if they don't have amalgams, a lot of mercury cases will drool at night, because one of the places that mercury is sequestered is the parotid gland, again, regardless of whether they've had amalgams. They do, which I think is a rhomboid test. If you have them, Romberg test. So if you have them stand up, stand on one foot, and then I have them stand on the other foot, and then I ask them which foot was the easiest, and then I have them stand on that and have them close their eyes. If they fall down pretty quick, typically you can find metals on that patient, among the findings. That might not be the case if they do lots of yoga, but otherwise, can almost guarantee they're going to fail that test. People whose vision changes, it's good one day, it's not so good the next. Maybe the right eye is a little bit blurry, but then maybe 2 weeks later, the right eye's fine and the left might be blurry. That's something that a lot of patients have that have metal issues. Unprovoked anger or depression. We've had people who were suicidal from metals. I had one patient, one of our people who's on now knows her, but when we lived in Cedar Edge, she was a sweet woman, and whenever she was dumping mercury, when she was driving through town, she would roll down the windows of her car and start yelling at people, for no reason. I mean, these are very severe cases. Any weird neurologic symptom is kind of outside the box. like a sensation of numbness. It's not true numbness, that doesn't quite fit one particular nerve root. So it might, like mine would start in my lip and end up in my ulnar distribution. So you couldn't quite say, well, it's trigeminal or it's facial or it's, C6 or whatever, or C8. Something that doesn't quite fit a normal pattern. People who are more sensitive to electromagnetic fields tend to have metal issues. It's almost like the metals act as conductors and just make the person more sensitive. You'll find it in most people that have fibromyalgia. It's not usually the main thing. Usually the dysbiosis is more primary, but usually they won't get total resolution unless you also deal with the metals. And almost any weird complex patient, you have, from people using mercury when they were processing felt. And now, because of all of the interesting metals that they're mining these days to use in computers and chips and everything else, we're finding a lot of things like beryllium and gadolinium and all these things that we never used to find. And I think if you go on my website, michaelleibowitzdc.com, I think I have a research paper on some of that Noah and I co-wrote that had a lot of information on some of the more oddball metals and maybe where you find them and, just what to look out for.
Do you want to start to get to questions people had, or still talk about some of the testing?
If the questions deal with what we've dealt with and aren't dealing with what we're going to get to.
What about, do you see metals to go along with vertigo?
It's back to Dr. Goodhart's old phrase that anything can cause anything. So potentially, yes, but there also, again, a lot of times with the vertigo, you might find food sensitivities, you might find dysbiosis, you might find hypoadrenia. There's all kinds of things you could find, metals being, one of many. That's why we always try not to take things out of context, and we always screen people for everything, because the more bases we cover, the better the patient is going to be.
And with that in line, what about MS?
Yes. We'll tell a story. So my niece's husband, he came in because he had a swollen lip and he couldn't figure it out. And I checked him and I found mercury. I never met the guy before. And it turned out he was a sushi chef. So I said, you got mercury, maybe think about not being a sushi chef. And not only did he continue to be a sushi chef, but he then decided, I'm going to Alaska to fish for the summer on a commercial boat. So he never had any other symptoms. So on the boat, he ended up with a very severe acute MS attack. And, he was pretty much partially paralyzed, and, he lost a lot of motor ability, and I forget if he lost any vision or hearing, but, we were able to get him back to normal. He's been doing well. He had one little flare up in the last 6 or 7 years, but otherwise he's running marathons over mountains and doing all kinds of crazy extreme sports type of things asymptomatically. But yeah, so definitely I see metals in every single MS patient as at least being part of it.
So when it comes to, obviously there's certain things that, like you said, when you're talking to a person, it might indicate heavy metals, but also, like you said, anything can cause anything. So what are some of the pros and cons of checking? How do you check if a person has metals or not, and if they're causing issues?
I think people have to realize what labs can do and what labs can't do. So for instance, let's say you run a hair analysis, and let's say cadmium ends up high. What does that mean? And the answer is, we have no idea. What if it means that the person is great at excreting cadmium? So all the cadmium that goes into their body basically is going out very quickly. It could mean that. So maybe cadmium is not an issue. It could mean that there's a ton of cadmium in the body and it's also being represented in the hair. So we can't, with a hair analysis, really have a good idea of body burden. Or what if it's low? What if cadmium's low in the hair? Maybe they're just bad excretors and it's all being stored in their nervous system. So all the hair is good at telling you is how much metal is in the hair, but you can't draw conclusions from it. In terms of the blood, a lot of the time, if you do blood tests, it shows recent exposure fairly well, but it doesn't take too long before the metals are stored in whatever storage sites, like, again, mercury might be stored in the brain, it might be stored in the parotid gland. I see that it's stored in the prostate quite a bit. Other metals are stored in other places in the body. So again, if it's not a recent exposure, you could miss it. There were urine tests, both baseline and provocative urine tests. If you tend to do labs, they're probably the best, but they still have the same issues. When I was poisoned by mercury, my provoked urinary mercury tests were very, very low because my body just wouldn't excrete. So, and if it's really high, again, you'd have to do a baseline and a provocative. And if the baseline is kind of in the normal range and provocative gets very high, you could tell that there's a good body burden. But again, there's lots of false negatives. I don't know if there's many false positives or not that way. There are probably some if you're an excellent urinary excretor. So theoretically, if you had 4 different people, each with a high body burden of the same metal, the other thing you have to know is one of them might be asymptomatic. One of them could be disabled from it. One of them might have, one particular symptom, like they have pins and needles feeling in their hands. The other person might have a mild case of MS or have ribs subluxate a lot or drool at night. Everybody's going to be affected differently. So the amount, it's important, but it's not that important. When we teach seminars and we're talking about, doing lab tests, I always kind of joke that the only accurate test for metal body burden is cremation. Because again, it's stored in places it's not going to show up on a lab a lot of the time. So, over the years, I've come to appreciate, what applied kinesiology can tell us more and more. Because when you're dealing with metals, what a good test, and we'll talk about that a little, what a good test could tell us is reactivity, not necessarily body burden. I have some patients where you could basically, bring a little bit of mercury into the room and they're so energetically sensitive that they start reacting to it. You have other people, who could eat, say, mercury contaminated tuna fish, and eat a pound of it a day and never have any problems. So, something like either an EAV type instrument or a muscle test done correctly can tell you reactivity. Because I think it's much more important to treat reactivity than to guess on presence from a lab and treat from that. That being said, there's a lot of, and I know some of you aren't applied kinesiologists, so you can just kind of take this part with a grain of salt. But there, with applied kinesiology, there are a lot of false negatives when you're dealing with metal testing. Also, applied kinesiology somewhat gives you an order, and occasionally in some metal cases, the body's not strong enough to start chelating, and it might not show on a muscle test on an initial visit. We try to make it show because I like to treat it right away, but sometimes it won't show, but it might show a couple of weeks or even a couple of months down the road. There are some things you can do if you are a muscle tester to make it show more. And this goes into a little bit the history of testing for metals with applied kinesiology. So initially, people used homeopathic remedies to test for sensitivity with AK, and homeopathy was very hard to interpret. Like, let's take a 6x solution of mercury. Should it, if someone has a mercury issue, should it weaken or should it strengthen? And the correct answer is some patients it might weaken, some patients it might strengthen. Because again, it could be that 6x is a therapeutic dose and they would strengthen. It could be 6x, they're still so sensitive, they might weaken. So it's really hard to tell. You know, when we started doing testing under magnetic fields, as Dr. William Philpott had discovered would work, and we started testing actually liquid mercury under the field, we got a much better test. There weren't any metal test kits out there that were accurate. We were actually buying minerals in a rock store that were high in different things and testing them. We used to have these available. And then eventually there was a doctor who made a kit out of powdered metals. And the kit was kind of expensive because it had things like gold and silver and platinum in it that made it not that cost effective, but it worked really well. Then there was a kit by Lifework Potential that worked decently, but they didn't use the real metals as a starting point. They used something called a ray card. And more recently, we had made vials from the real metals. We had purchased the real metals from various sources, and even some of the oddball ones like gadolinium and beryllium. And we made a kit that's part of our protocol kit. And we've been testing with that because people before that were complaining, you know, these people sound like metal cases and we're just not finding it with muscle testing. And there are other things you can do because, again, if the person's at rest and not stressed when you're testing them, you might miss things. You know, sometimes we'll massage the person's parotid glands before testing if we think there might be a mercury issue, or we might massage their liver because some of the metals are sequestered in their liver. We might kind of knead, like KNEAD, the liver before testing. Or we might rub the abdominal fat because that sometimes some of the metals are stored there. Anywhere that the metals might be stored, if you could kind of stir it up a little bit. And metals, Dr. Schmidt found a long time ago that metals show up more if you're testing from across the midline. So what we do is we test the PEC minor across the midline. So the test is like that against resistance. And it's a good test. You'll find more metals that way. But again, that's for the AK people. For the other people who don't do AK and aren't going to learn AK, I'd probably do provocative urine tests. But again, they won't be quite as good in what they're measuring.
So some questions? You want to keep going about treatment?
We can, if there are any questions that don't deal with treatment.
Someone asked if you ever see aluminum affect lungs and breathing.
Yes. But again, a lot of it's going to depend on the method of exposure. You know, I mean, some people are going to ingest aluminum because they cook an aluminum can. Some people are going to absorb it through their lymph because they rub it under their armpits, you know, in a form of a deodorant. You know, some people are going to, you know, they might be a welder or a plumber and they cut aluminum or they might be downwind of some factory that belches it out, or they might live in some states that have a lot of, I mean, aluminum is very heavy in the soil. So if you live, for instance, in Hawaii and the volcano's erupting, you might be inhaling aluminum. Or if you live in Utah or some of the states where they have a lot of it and they do a lot of mining, you know, it might be part of the, you know, your air. So again, a lot of it's going to depend on how it gets into the body, though theoretically, even if you ingested it, say aluminum, it could affect your lungs, but it's much more likely to if you breathe it in.
I could talk some case studies, or we can just go into treatment.
So we're not.
We have questions written down. Most of these are more treatment related, though. Actually, one question: are certain metals? One person had a question about, are certain metals stored in visceral fat / lipophilic versus others? Are there any specific ones?
They are. I don't remember offhand. There's a book that I really like by Cynthia Wilson. It's an old book. You want to get it? It's back there. I forget the name of it. It's chemical something, and it lists about a couple of hundred chemicals and metals. And beside listing, symptoms that have been shown in the literature, you can probably get it for a buck used. Chemical exposure in human health. So, for instance, if we look up aluminum in here, okay, so aluminum, it has something that's called endpoint targets, which basically is where it tends to be stored in the system. So for aluminum, it says it's mainly stored in the respiratory system. It lists all the different compounds, and then it'll list symptoms: cough, pulmonary fibrosis, bone disease, increase in softness in bone, skin sensitization, brain dysfunction. And then it tells you some things you'll find it in: aluminum foil, antiperspirants, aspirin, cosmetics, etc. So it's a nice little reference. I'm sure you could find that stuff online. I just haven't searched it out because I've been very happy with that book.
Someone asked about how much of your success is due to clinical detective work, experience, and cleverness versus just doing your protocol and treating what you find.
Sometimes I had a patient, it was within the last week, and I was testing them, and I test 24 different metals, I think, on people, or maybe 25, I forget. And I remember finding zinc as a toxic metal, and I thought, well, that's really interesting. I find it occasionally. And then, I said, well, when we got to the part where I like to test the supplements they're taking, I said, let's see the supplements you're taking. They were taking a multi that had about 30 milligrams of zinc, and they were taking 50 milligrams of isolated supplemental zinc. So it's kind of a neat correlation there. A lot of times that happens. We'll find someone who shows up on copper on our muscle test. And then sometimes after we find the metal, we go into more detailed detective work. This woman was on the swim team, and they were using copper sulfate as an algicide in the swimming pool. They also do that in hot tubs, and they also use copper sulfate as a fungicide on organic produce. So, but it was interesting how, we'll find metals, and then they go, oh yeah, I live, next door to a mine. We had one patient like that, so sometimes the detective work is more so that they don't, continue to have exposure while we're treating, if that's at all possible.
I had a patient that showed up for copper 2 days ago, and she had just got back from doing this therapy that was in a swimming pool on the Big Island. And after I'd already found copper, put in my notes, she had complained about how the pool that she was in was too high in copper and it turned her hair green, which I thought that was kind of cool because I'd already found copper in her before she even mentioned that. And I'm completely oblivious, apparently, that her hair was green. But that's another story.
Oh, the name of the book again is Chemical Exposure in Human Health by Cynthia Wilson. It doesn't have all the stuff, but it has, quite a few things. And it's a good one for just chemicals and things too.
Do you want to talk now about what to do with amalgams?
My opinion, there are two issues with amalgams. One issue is what's called electrogalvanism. So for instance, if you were to take two different probes and touch two different amalgams and measure the amount of current that's running between them, there used to be a instrument that I used to have called something like a galvanometer, or I forget what it was called, and we used to measure that. And those people that are having a lot of current, those are the people, like if you watched the 60 Minutes on Mercury years ago, they only played it once, and then it was banned basically because it was just too condemning. But they showed some people who basically were disabled, and suddenly they took their amalgams out and they were out dancing even they hadn't walked in, a couple of years. Those are the people with the high electrogalvanism. Because the thing is, when you take amalgams out, you're going to expose the body to lots of mercury, no matter how you do it. It's definitely good to have a rubber dam and all that stuff, but there are so many tens of thousands of microtubules in your teeth. And when you drill, there's heat involved and the mercury vaporizes, and some of it goes into your mouth and can be captured by the rubber dam, and the rest of it goes through the tubules. It's picked up by the trigeminal nerve. That's been proven. So I'd say 95% of the people who I test who have had their amalgams removed within, say, a year or two, you find mercury on. When I talk about my case, and I can give you other cases of people who developed MS, people who developed Parkinson's, going to good natural dentists having their amalgams removed because the exposure just tipped the scales. So I personally, on most people, like say my wife, she still has a few amalgams in her mouth. I'd rather she leave them there and let the little bit that is going to outgas, and her body can deal with just a little bit, on a daily basis, as opposed to just giving it one big dose. If people are insistent on it, we typically like them to do one at a time. And if you're an AK practitioner, I only like to do it when mercury is not showing. If mercury is showing, there's more of a chance you're going to tip the scale. So I like to do it, when it seems like they can handle it. And then we do one. We'll have them come in like a few days later and see if it tests. If it does, they don't do number two until it's back down, not having tested for a while. If they don't test, maybe we would, and they have no symptoms, maybe we would do more. We also have them take, which we'll get into later, some supplementation pre and post. But again, at this point, I've seen enough people's lives ruined by good amalgam removal that I'd rather leave it in. The only safe way to remove amalgam is if the filling falls out, because then you don't have to drill through it, or, which I don't recommend, is if you pull the tooth. And some people have amalgams in so many teeth, they basically, a lot of them, you'd be removing all their teeth. So I'd rather leave it in. I don't believe, as some people teach, that if you give a heavy mercury chelator while their amalgams are in, that it's going to create a lot of problems. I just don't see that.
Someone asked a good question.
But again, if they have the electrogalvanism, I would tend to, or you could use a little stick magnet and therapy localize. If you were going to take out, I would take the ones out that therapy localize.
Someone asked if you ever use Cyrex Labs, which does immunological testing for metals, and if so, do you find it correlate with AK testing, which you can mention with our Alaska patient?
We used to do, Walter Clifford until recently had a place called Clifford Consulting, and he did metal testing for both dental and for orthopedic appliances, somewhat similar to Cyrex. And we felt that sometimes they would pick up on things that we would miss, because again, with muscle testing, you have to tweak it pretty well to not get some false negatives. And I don't know if what we know now with testing, we would pick those up or not. And I assume Cyrex is the same. We tend to use it more if people are going to do something. Noah's going to tell you about this one patient from Alaska, but for instance, if someone brings in, say, they're going to have an implant, be it a zirconium dental implant or a titanium dental implant or a pin put in somewhere, if their body hasn't been exposed to it before, a lot of times it doesn't muscle test because their body just, it's like if you tested a vial of plutonium on people, it's not going to show up on a lot of people. There just isn't any recognition. So a lot of times what we do is we'll take the substance that they're going to implant, we'll get a sample of it from their doctor, we'll tape it on their body for a couple of days so they have some exposure. Then we take it off, and then they come in the next day, and then we test them on the substance, because you're much more likely to not get a false negative that way.
I mean, so we had a patient that flew in from Alaska, um, basically complete disabled, pain, swelling, big, strong guy,
Weird rashes all over.
weird rash all over his body, couldn't do anything. A lot of it had happened after, which, when we spoke to them, a lot of it happened after he had hurt his knee, and he ended up having a metal screw put in, and he had a cadaver part put in. And then, he came in, and obviously you think, okay, it could be some type of immunological reaction to the cadaver part or to the metal or something like that. But, like you said, you never want to take anything out of context, even when a lot of the symptoms and the timing seem to make sense. It doesn't mean it's actually that's what's causing it. So we did our whole exam, and we really didn't find metals. What we actually found was Lyme. And the guy lives in Alaska. He goes camping. He's been bit by things. And he was in for an intensive week of treatment. And in the week, we really didn't do anything for metals. Just worked on Lyme disease with the guy, and also other, not just co-infections, but parasites, fungal issues, things like that. Took him off a bunch of foods that he was sensitive to. And in a week, he was pretty much asymptomatic. But then we did recommend that he did get testing done that checked for his sensitivity to his screw implant. And it was actually interesting. I forget, one of the metals, I believe, or two of them did show up fairly reactive. But we never found, the thing is, so we never found those metals, at least with AK findings, and we got the guy asymptomatic. So, his body in some ways didn't like the metals, as you could see on the blood tests, but at least that wasn't causing his symptoms, and we're able to get him feeling fine, even with that showing up positive.
One other thing with metals going back, definitely metal implants can trigger autoimmune issues. People might get, like for instance, I shattered my patella, and they put my patella like in this metal cage, basically stainless. And within a couple of months, I developed this full-blown autoimmune disease, which I had never had before. And that can be fairly common too. So, a lot of autoimmune diseases will have a metal component. If everything else in me was perfect, maybe the stainless wouldn't have been enough to do that. It's hard to say.
Someone asked about, for patients getting joint replacements, how would you test that the metals used for the replacement wouldn't be harmful for them?
It's the same kind of thing. I would do both tests. I would, if you can get a sample of what they're going to put in, that would be ideal. If you can't, I would at least get the name of it, look up what it's composed of, test all the components. And I would also run something like the Cyrex test.
Do you want to talk common sources or treatment?
Why don't you go into sources?
Okay, so when it comes to sources, there's so many different sources. A lot of the times, the metals that we find, I feel like, are past exposure and they're not active, but sometimes they can be active. If you look at water pipes, obviously you can have lead in water pipes, but you can also have copper. And that's one thing of asking the people, okay, when was their house built? What's their piping made from? That type of thing. So again, certain questions.
It's really interesting talking to plumbers, and they'll tell you how the copper is eaten away in plumbing in almost every place I've ever lived. I don't know if it's the acidity of the water, but basically, within a couple of years, the diameter the thickness of the copper in the pipe is probably 50% what it was when they initially installed it.
Treated lumber, they use a lot of arsenic for termites.
And copper.
Cosmetics. Cosmetics obviously can have a lot, especially the more natural cosmetics, because they don't add necessarily chemicals. Then they add different metals like copper and things like that to give them the color. Look at deodorants is always a big one. One thing that they do a lot of, if you, let's say, go to Whole Foods, you can find no aluminum deodorants, but then you can also find ones that are no aluminum chlorohydrate. So they don't add aluminum chlorohydrate, but they add a different form of aluminum. It's bigger, not as readily absorbed, but it's still absorbed. So you can get exposed that way.
Yeah, any deodorant that says no aluminum chlorohydrate, you can almost guarantee it has aluminum in it. If it had no aluminum, it would just say no aluminum.
Same thing if you have like the mineral salts, those types of deodorants, you can definitely see. Fish, obviously, there's certain fish that's much higher in mercury, the large tuna species, swordfish, different things like that. I mean, they've found mercury in almost all fish, even wild Alaskan salmon, much lower amounts, but they have found in a lot.
In the southern hemisphere, the fish have about half the mercury as the northern hemisphere.
Some salts, you have to be very careful. Some salts can have heavy metals in them. You can also look at like different supplements.
Especially some of the mined salts, like there are some that are mined in Utah and so forth that, again, because of all the mining there tends to be a lot of different metals in the soil, and it can get into the salt, or was initially in the salt.
Same type of thing, like there's some trace mineral supplements and things like that come from the Great Salt Lake, which you have to be careful, because if you read about the Great Salt Lake, the mercury levels are off the chart from all the mining. These do a lot of gold mining, and copper, and they'd release mercury into the air, and then it would all settle into the Salt Lake. So you got to be careful with things like that. Cookware, there's a lot of different things can be in cookware. I mean, obviously you have the chemical aspect with Teflon. You can get iron from cast iron. You can get exposure. So that can be one thing.
And you can get nickel from stainless steel.
From stainless steel. So I mean, besides glass, there's not a perfect cookware out there. Aluminum added to water. It
helps settle all the turbulence out. So they'll use alum in the municipal water supply.
Also, one thing which is credible, you do have cloud seeding to increase rain, and they put aluminum in for cloud seeding.
And silver.
And also, silver more for cloud seeding, which we do find silver in a lot of people. Hot tubs and swimming pools, again, which algicides and different things. Organic herbicides and fungicides. So if you get organic grapes, great, doesn't have all the chemicals in, but they spray copper on it as a all natural organic fungicide. So you do have to be very careful with that. Ceramic pans we've found overall to be pretty good, someone asked about. And my dad said how the mercury content in the southern hemisphere is much lower than in the northern hemisphere.
In fish.
That's one thing.
Downwind of power plants, coal burning power plants. The coal can be high cadmium, it could be high mercury.
Obviously you have vaccines, you can have mercury, which most vaccines don't have thimerosal anymore, but occasionally they do. You have aluminum. They replace it with mercury and they give it aluminum. Great. Tattoos, especially the different dyes, the different colors, those will have heavy metals. You have hair dyes. You have things like gadolinium, which is in an MRI contrast agent. If you guys remember Chuck Norris, the actor and martial artist, his wife got poisoned from MRI toxicity, basically from gadolinium. That was one reason, at least for muscle tests, when we updated our test kit, I had a patient that had a lot of symptoms that seemed gadolinium related, and we found that. Also, again, looking at at supplements. If you look at a lot of pills, junky ones, but also some good quality, I'm going to put that in quotation marks since they're really not good quality, titanium dioxide. It makes your pills look nice and white, but that's in, and they've actually found that can aggravate celiac and a lot of other things like that. Jewelry, you can obviously get exposure from jewelry. Implants, you can obviously have silicone, but they also have titanium in the outer covering or the outer layer. Or zirconium. And I'm talking breast implants.
Oh, okay.
Then you have obviously dental implants with zirconium and different things like that. Sunscreen. So, obviously you have I'll call it junky sunscreen that has all the different chemicals that are going to change your hormones and all that type of stuff. But then you can get the more natural sunscreens, and one of the most common ingredients is zinc oxide. After I got married, I got my wife on an all natural sunscreen. She was coaching tennis in Arizona, and she was putting on sunscreen every single day. And she started to get migraines about 4 p.m. every day. And my first thought, okay, you probably threw your neck out. Didn't do anything. Then I think you're probably eating the food that you're sensitive to. Didn't do anything. So then I'm just going through a lot of stuff. And I found when testing a lot of things, she showed up really badly on zinc. And then I tested her sunscreen, and her sunscreen tested really bad. So I stopped her zinc oxide sunscreen. I actually gave her a copper supplement for a couple of days. And then everything was great after that. No more issues. So again, she basically overdosed on zinc, applying it topically. Supplements are really, really big ones. We see a lot of people where silver causes a lot of issues, and you get silver from cloud seeding, but also you can have colloidal silver. We never use colloidal silver. We're not saying that it doesn't work. It can work. Anything, you guys all know anything that is ingested in your body, not all of it's going to come out. Some of it can stay behind. So if you're ingesting silver, you're going to be leaving at least some silver behind. So there's much better ways to treat infections than ingesting silver. That's why, you have all different types of herbs that, in my opinion, actually work better. And you don't have the risk of leaving behind silver in the body. You also have some colloidal copper and colloidal gold supplements and things like that.
Going to this book, if you look up silver, for instance, it's actually stored in the nasal septum, skin, eyes, symptoms, upper respiratory irritation, nasal septum, throat and skin, gastrointestinal distress, contact dermatitis. Silver deposits in neurons in the central nervous system, suspected of causing listlessness, loss of appetite, malaise, memory loss.
So again, much safer, in my opinion, better treatment methods than using that. Same type of thing with other supplements that are high in humic acid or fulvic acid. If you look at they have mercury, they have gadolinium, they have a lot of other heavy metals that will store in the nervous system and can cause a lot of serious symptoms in people. So it's like, why would you're basically giving a person heavy metals to try to pull out other heavy metals.
And again, we're talking reactivity. So when you put it in, even if, like, for instance, there's a sub like zeolite or TRS, they're aluminum-based compounds. And even if, as they claim, most of them pass through you, which is hard to really prove one way or the other. Still, if your body's reactive to that metal, it's going to cause some type of inflammatory and neurologic reaction on its way through.
And again, that's why we will talk, a couple of people have asked, we will talk about treatments, what we do, just in a minute. So those are some of the ways that you get heavy metals. And, we've had patients bring in their, at least for muscle tests, we've had them bring in their beauty products and different things like that and test them on people to see how they are doing with them, since you do have to be very careful about exposure, since you don't want to keep getting more metals in when you are trying to chelate them out. One person asked about Parkinson and metals.
I have had one case that was totally reversed when we chelated out metals. But you do find metals in Parkinson's cases, though sometimes you just find different toxic chemicals as opposed to metals. And sometimes you find both.
And someone asked about metals or chemicals in psoriasis.
Some people link nickel to psoriasis. I've seen nickel linked both ways. One is a causative agent, one is a cure. It can definitely be linked, yes. But again, it's going to vary, which metal it might be, but any of them, because again, the metals can cause autoimmune disease, and psoriasis is an autoimmune disease. I have personally seen that.
So when we get into treatment, there's a lot of different treatments.
Let me say one thing.
Okay.
So if I think metals are like a really important part of the patient, I'm very transparent with them, because like let's take mercury. Mercury could theoretically cause nerve cell death, or it can just clog up receptor sites. So I'll tell a person, okay, I think, mercury is a big issue. It's definitely slower than cleaning up dysbiosis. Dysbiosis, if we do it right, we can usually clean up in weeks. Metals can be weeks, but it can be months or even years in some cases. And sometimes you don't see the results for a number of months. And again, sometimes it's so quick, like the initial stories that we told. So I'm usually transparent. I say, I think metals are a big issue. I don't know if you can find anyone else who would confirm it or not. We might get results pretty quickly. We might not know for a few months if we're going to get results. And a lot of times we can reverse things. And sometimes the metals have done, quote, irreversible damage. Like, for instance, with my amalgam story, even though most of my symptoms resolved, there's still a sensation of numbness I have on a few parts of my body. There's no true numbness, there's no motor dysfunction, but I've had for 30 years that maybe it's irreversible, but maybe it's reversible. If it is, I have not found how to do it. Neither has the many wonderful doctors that I've talked with or been treated by.
When it comes to treatment, we have some more general recommendations that I look at, kind of clean up a lot of different metals at once, and then some more specific ones. Kind of like I mentioned how my wife overdosed on zinc. Copper is an antagonist for zinc. More often, I'll use zinc for people that have copper issues. Zinc can help push out copper. If you look at a periodic table and you have certain metals, you can look above and below to see what can kind of displace them. So like cadmium can be a really good, not chelator, but it can help you detox mercury, but it's also going to kill you. So you really don't want to do that. But you can, sometimes you'll get some ideas looking.
But zinc is on that same vertical line of the periodic table. So zinc could theoretically help either one.
Yes. So zinc also can work well for mercury or for cadmium. So these are kind of different things that we'll look at, sometimes looking at, okay, what can we give? The most common thing that we use for heavy metals by far is Toxicity. A lot of different supplements I look at for heavy metals, I look at either as weak and gentle or strong and harsh. Toxicity I look at as strong but gentle, which is one thing that I really like about it. Interesting, with Toxicity, it goes through the GI tract and it seems to pull out all different types of metals. I've seen it work for mercury, for copper, for silicon, for all different types of things. People do have symptomatic improvement from taking it.
One thing that's interesting when you're chelating metals is even if you have, say brain storage, and the half-life of mercury is in decades, for instance, if you pull it out of the rest of the body, the brain oftentimes will dump some of its stored metals into the body. So you'll actually decrease the burden in the brain by treating things that are in the body. Toxicity does that really well, among other things.
Toxicity, like I said, is what we use by far the most. There's actually, I know some people think you can't take it long-term because of chelating out nutrients. We've never seen to be the case. I actually just had a doctor email me 2 weeks ago, I think, and she was saying how she's been using Toxicity on a couple of patients for over a year, and straight every single day for over a year. And she's run, it wasn't SpectraCell, but it was another intercellular nutrient level test on people. And she said after a year of taking it daily, their nutrient levels never dropped. So she was very happy that it didn't seem to be chelating out any good stuff. It was just chelating out the bad. She was very pleased with it, which I thought was kind of cool. And like I said, that's what we use most often. We do use MT Supreme. MT basically contains different herbs that increase metallothionein in the brain. So metallothionein is one of the processes in the body that uses to dump different metals. So MT Supreme will help the brain, but also the whole body to dump metals. I haven't seen that you have to use MT with Toxicity. Sometimes I use both. Sometimes I use one. I haven't found, if you use MT and let's say it causes the brain to dump metals, I haven't seen that they cause symptoms elsewhere, stir up anything, so you don't have to use both at the same time. ALA, alpha lipoic acid, that's one that we will use for different heavy metals, lead, but also copper. It can work as a good chelator with that. Usually use around 300 milligrams a day, sometimes a little bit higher. We rarely ever use or recommend IV chelation. Usually that is just way too harsh on people and pushes them over the edge. And
EDTA is kind of controversial. Some people say it will make mercury travel up into the brain.
Have you ever used MMS for treatment, someone asked?
It's never tested well, but I haven't specifically tested it for metals. In terms of, one thing that, is, a prescription item, which sometimes is helpful, is DMSA. Thorne used to have it decades ago for Captimer. We do know naturopaths who can prescribe it, and MDs can prescribe it, and they make it in compounding pharmacies. We do test it on folks. Occasionally, I'd say maybe 10% at the most of our metal patients does it look like it might be a good thing to add to their regimen, and usually we'll have them, we'll recommend, maybe someone who might be able to prescribe it for them. We do warn them that if they take it when they don't need it, it can deplete their zinc levels. Their urine's going to smell like it. It's a much more harsh, there are more chances of some side effects, but occasionally it can be incredibly useful.
So someone asked about EDTA suppositories. I assume you're not a...
one case, and I don't know what to say about this case, but this was probably 25 years ago. And we had recommended EDTA suppositories to this one patient. And they claim that ever since then, they've been incredibly electromagnetically sensitive. And they actually, for the last 20 some years, have lived in a house without electricity. And they say that it was the EDTA suppository that took them over the edge. I'm aware of them. They might have their use. I probably wouldn't use it in a mercury case, but again, I tend to go by my testing. And if it tests well and I can't make it not test well, I would test it over all different organs and other things. I might consider recommending it, but at the same time, have them on. I wouldn't do it as a standalone.
And I know there's a lot of different protocols nowadays that kind of get confusing about dosing heavy metal chelators, especially DMSA, based off their half-life. Have you ever found the need for that, someone asked?
With DMSA, and again, I'm not allowed to prescribe it, but I can tell you about my experience back when I was allowed to prescribe it. I didn't like the protocols that they use where, so many days on, so many days off. They tended to give very high dosages. Some people could take up to 1,750 milligrams per day for so many days. It tended to really stress the liver and the kidneys. When people did that, what used to work for me is I would have them just take anywhere between 250 and 500 milligrams at bed. So in case in case it caused them to flare a little bit, they'd sleep through that part. Though sometimes I might have them try it once during the day, because some people, it would really clear up their brain fog. So depending on how they responded to it, that might determine what time of day. But we would tend to just give 250 to 500 and reevaluate every 10 to 14 days, because their body would want to take a break every once in a while. And again, some people, needed to be on it for a short period of time. When I was taking it way back, I needed it for like 6 weeks straight. Now I need it about once a year. I can just tell that something's off, and it's the only thing to test. I still take some of my 10-year-old stuff that it doesn't seem to expire in terms of effectiveness. The other things are, sweating in terms of saunas, we used to send sweat samples from saunas into different mineral analysis companies. We found that saunas were very effective at getting rid of copper. In fact, the companies didn't know, what they knew they were testing sweat, but they didn't know anything else. And they called me up and said, are these cerebral palsy patients because the copper's through the roof? And then I told them, no, we were provoking sweating with the sauna. We found clinically that exercise in the upper body extensors does tend to encourage mercury excretion from the brain. I can tell you this clinically. I can't tell you why, but when we used to have an upper body cycle, and we used to have people just do the pushing, so not pulling so much as push, push, push. Some of our patients with, like our MS patients and so forth, we exacerbated their symptoms by doing that. So if the people are heavy exercisers, you might want to balance that out. Sometimes it might be good to do that to provoke excretion, and sometimes that might take them over the edge.
Someone asked if ALA can bring metals to the brain. And at least in mine, I would say I don't use ALA that much. For me, I only use it if it muscle tests, and I've seen some, I don't use it that often, but I have seen some wonderful cases that it's helped people. I've never seen it harm anyone or screw up anything.
But you only give it when it tests like it's indicated. And again, It's so hard to tell because, how can you do a test to see how much metal is in the brain without dissecting the person? It's really hard to know, for sure.
We had a question about, do you ever find metal issues with people that have trouble sweating?
Yes, definitely. That's one of my history questions. If the person really seems toxic, I always ask, do you sweat easy? And if they say no, they're always tougher cases. But I have also found, and this is really weird. So in some of those patients, if they're wearing metal jewelry that surrounds things, like it goes around their wrist or it goes around their neck, maybe it's the mild electromagnetic field put out by the jewelry when it's used in that way. But sometimes when we've had them remove those and not wear them, it could even be a ring, their sweating would improve quite a bit. And other people, once we start metal excretion, either with supplements or sometimes with the sauna, we kind of make a breakthrough, and then their ability to sweat is restored.
Sauna we found copper levels to be the highest in sweat from saunas, but it does seem to help with other metals also.
Yes, but we never found high mercury levels in saunas. So I don't know if it's effective. It might, it might make it come out some other way. It's hard to say. There are all kinds of things that people claim are going to get rid of metals. You have the foot baths. We found personally that we used to send the foot bath waters in for metal analysis. And we found for the most part, the metals that were high in the foot bath water were basically metals dissolving off the rings in the machine. It wasn't that it was getting you to excrete metals into the, through your feet, though in a couple of cases, we did find a little bit of increased urinary excretion of metals. And it was hard to tell, was it from the machine or was it from the person's body?
Sauna versus steam room, ever compared?
I don't think a steam room would be as effective because it's hard to measure how much you sweat in a steam room. How much of it is just the steam. So you'd have to, check some studies and see where do you sweat more.
Sauna versus infrared?
Well, infrared is a type of sauna. Infrared might be a little bit better. I think it's a little bit overblown in their promotion of it, but an infrared sauna might be better than just a regular sauna.
What about the most effective method to detox mercury and lead?
Every patient is different. I would definitely make sure they're not eating fish if they were a bad case, and not eating seaweed if they were a bad case. And again, depending on where they're living and so forth, make sure they're not living in a high metal area. And usually we'll give Takasumi, and if it's a really bad case, again, depending on the case, maybe some of the other things we talked about, MT Supreme, DMSA on occasion, everybody's different. You can't cookbook metals.
Do you recommend that a patient be clear of dysbiosis before treating for metals to avoid potential
That's a great
reabsorption?
question. I either like to clear up the dysbiosis first, or it seems to work if you do them simultaneously. But I wouldn't treat, if a person had metals and dysbiosis, I wouldn't treat the metals first without treating the dysbiosis. But we've treated enough people simultaneously and not run into problems, though a lot of our patients, again, sometimes the dysbiosis will show up first. And I always look at dysbiosis as having a high chance of being primary. So I don't see anything wrong with leaving the metals till after the dysbiosis is clear, if that's how you prefer to do it.
So here's a good question. If someone with complex chronic illness, how often do you find heavy metals are a more significant issue compared to mold, infections, and other environmental toxins?
20%.
And do you commonly see a metal treatment focus being the major needle mover in someone with Lyme, chronic fatigue syndrome, fibro, and various neurodegenerative conditions?
No to Lyme. What was the second one?
Chronic fatigue syndrome.
No to chronic fatigue, sometimes in fibro, and more so in the chronic neurologic conditions. But again, not to say that they're not components, they're not just the major game changer usually, or they're not the thing that's stopping the patient from making progress. Some people teach that you can't, get metals out unless you clear parasites or something like that. We have not found that in our practice.
Do you have experience with clay baths or packs to pull out toxin and metals?
We used to recommend dead sea salt baths, and that can be effective. It also does cause a few people to flare. Clay baths would be pretty similar, but I'd want to see an analysis of the clay because sometimes clay is very high in aluminum. But that can also pull, you're doing some good in the sense of you're using the skin as an elimination organ and taking a little bit of the load off the liver and kidneys. So sometimes we'll do that in combo, just like a sauna. We'll do it in combo with the supplementation. In supplementation, like Takasumi and DMSA and so forth, you're kind of dividing excretion between urinary and fecal. But again, if you can involve the skin too, it just makes it easier on the other organs.
And that's one thing, since, like you mentioned, with different clay contamination, bentonite clay, similar to fulvic or humic acid, it can contain some very bad heavy metals. So you have to be careful with that, which is the reason we generally don't recommend it. Do you ever find water fasting helps?
I think water fasting, you're asking, it can help, but you also, if their nutrient reserves are low, you could cause some damage. I'd prefer in a case like that, juice fasting with supplementation and with emphasis on sulfur containing produce in your juice. Like a lot of times in the metal cases, we really like our patients to eat more Brussels sprouts. Of all the cruciferous vegetables, Brussels sprouts seems just clinically to be the most effective at helping chelate metals out.
And how often do you find fungal issues or similar dysbiosis clear up from clearing metals?
Rare.
The one thing I'd say is every now and then you do have some people that you can clear up their dysbiosis, but they seem prone to getting it again fast. And sometimes if you detox the metals, then they don't keep getting the dysbiosis. Their immune system is stronger against future infections. But I wouldn't say I've ever seen a case of dysbiosis that you can't clear until you detox the metals.
One other thing with metals, sometimes, and this isn't every patient that has this, but there are some patients who you might test foods and you might find, a group of foods. Next time they come in, you find a different group of foods, and next time a different group of foods. Are just switching all over the place. There are people who think, they need to live on a rotation diet the rest of their life. A lot of those type people have metal issues, and sometimes resolving the metals will make them more stable when it comes to foods.
What about the supplement metal free? Have you ever used that?
I've read the ingredients in the past, but I forget what they are. I would just, Why don't we go to the next question while I just look that.
Have you
up the
found any
ingredients.
benefits from cilantro as a chelator?
Use your phone on that.
Okay.
I think cilantro is a good food. I think it's way over played as a metal chelator. And I don't like it. I mean, with the Brussels sprouts, I might tell people to eat some cilantro or maybe juice it, along with some other things in their juice. I don't like to give tinctures of cilantro.
Someone asked about if we tested modified citrus pectin. I know I've tested it a little bit. I've used it a little bit.
This is the wrong one. It's not a supplement.
I can't say that the times that I have used modified citrus pectin, I can't say that I have found an improvement that I hadn't gotten elsewhere.
I'll tend to use it more to stop metastasis.
Yes. Otherwise, for the modified citrus pectin, I mean, there's one study that showed how it increased lead secretion in children, I believe in India. But if you actually read the study, it was really, really horribly done. And there's a lot of questions that the numbers don't make any sense. So it's hard to say if there's actually any research to show the modified citrus pectin actually is good for metals. But yeah.
So when you read the ingredients of the metal-free, the microactivated algae, the chlorella, I'd want them checked for metals. It also has ionic sea minerals, which could sometimes be problematic, as could the fulvic acid and ferulic acid. The other ingredients like lipoic acid, glutathione, vitamin C, and even some of the probiotic strains potentially could be useful. With the one lactobacillus strain, I'd want to see what strain it is, because a fair amount of lactobacillus strains are histamine producers, which might inflame the patient even more.
What about chlorella for heavy metal detox?
I wish I found it useful. We used to eat a lot of chlorella back before we were testing. I think there's muscle testing is interesting because something could be good and bad. Like chlorella might help chelate out metals, but it also has excitotoxins in it. So it might not be the right product for that person. So we might find it doesn't test very well, but it still might help a little bit with the symptoms. I got a patient today who was taking a product. It had fungal enzymes in it, like protease and amylase and some other ACEs. And she was finding it was helpful in dissolving some biofilms, but at the same time, she was feeling worse in other areas. And it was because those particular enzymes are giant histamine producers. So she was getting a lot of sinus inflammation, and it didn't test well. And she actually took it against my wishes because I told her it didn't test well, but it did help her in this other way. So, we don't, as clinicians who are applied kinesiologists, we don't give things that don't test well. If it tested well, and it still tested well after temporal tapping, and we do something called a distance test, which we teach in our seminars. If it passed all that, it might be good for that particular person. We just don't find it in that many people.
What about BioSil, which is silica-based for aluminum chelation?
Might be good. Haven't tried it. We haven't had any problems with aluminum, so we haven't really tried it, but I understand how silica can chelate out aluminum, and yeah, it could be useful.
One thing you do have to be careful with, just like with zinc, which can be really good, you can overdose. Same thing with silica. I know I was taking a methylation product and I started to get headaches. My dad tested me and he found silica just in our test kit. And then I was looking at the supplements I was taking, and one of the main fillers was silica. So
or silicon dioxide.
Silicon dioxide also. So you do have to be careful of that. You can OD on it, even though most people it's going to be inert and fine or helpful. Any other questions? We had a lot of good questions on here. I've had a few questions that were a little bit unrelated, and I usually just asked the person to email me. I'm more than happy to chat with you about them. EMS.
Do you have your own metal test kit now? Yes. Well, it's in our we changed our protocol kit around a while ago so that it had the 24 metals in it that our starting material was the real metals. So it's part of the protocol kit. We could theoretically sell the, just the metal part of the kit. You would just contact us and we would just, figure it out.
It has 24 different metals. Just shoot me an email. With EMS, I'm not quite sure. EMS meaning, someone asked about EMS in the brain. I don't know if they meant EMFs or they're talking about eosinophil myalgia syndrome. If you want to clarify that. Then we had one other question. Oh, EMFs, electromagnetic sensitivity. That was something my dad mentioned earlier, that people with heavy metals are often, he sees it almost acts like an antenna, and it definitely makes people more EMF sensitive. So oftentimes for people that are very EMF or EMR sensitive, if you treat the metals, oftentimes the EMF or EMR sensitivity will significantly decrease.
And occasionally it's the reverse. Occasionally EMF sensitivity will make you more reactive to the metals. So sometimes if you deal with the EMFs, the metal sensitivity will decrease.
Do you answer, Dr. Landers?
How would you use temporal tapping with testing you talked about? If a supplement tests well on a patient, meaning it strengthens but doesn't cause hypertonicity, we'll often temporal tap the patient and retest the supplement to see if it still tests well. If it doesn't, we don't prescribe it. There are also other things we do, but that is one of the things that we do.
And like you said, we tri-field tester. Dylan, include that in the email and I can answer that for you. Unless you want.
Well, the tri-field meter which they use to measure EMS, it has like an electrical setting and a magnetic setting and an expanded magnetic setting, and it might have a microwave setting. I usually look at the expanded magnetic, and if it's over 2, then I go to the regular magnetic setting and I look to see how high it is. Again, if it's something where you're not spending a lot of time, if it's just high in front of your refrigerator and you're not spending hours a day, hopefully in front of your refrigerator, I wouldn't be that concerned, but I would definitely check, where you're sleeping, and where you're, if you're sitting at your desk a lot, I would check all those areas to see what it's like.
Someone asked me about the entire test kit that we use. If you go to my dad's website, michaelleibowitzdc.com, there's a short backlog, but that should be fixed in the next 2 weeks. But you can go on my dad's website and
this is going to sound self-serving, but it's not. But I hate to sell test kits to people that haven't at least taken our Vimeo seminar, because you're going to probably run 50-60% false negatives if you don't know how to use it.
Yeah.
And that goes with any kind of diagnostic vials or anything.
Do you have an answer for this?
Ultrasound to detect metals. Interesting. Don't know, have no idea. Have we found out using a laser on organs helps increase metal clearing? It could. It theoretically could. Also, we found that just exposing people to electricity, like for instance, if you had some type of electrical device, we have all these old gadgets in the clinic, like a violet ray tube, or if you had a Rife machine, or any kind of electrical things that they were holding, or you stuck a Tesla coil near them. If you do that, it does tend to enhance excretion, or at least get it into the circulation. If you don't give something at the same time, you might end up making them worse. The other thing about muscle testing, and again, this is a little bit weird, but don't look for metals unless you're going to treat them. I had this one doctor come when we were in Colorado, and he wanted to know if he was mercury sensitive. And I said, I really don't like to do that unless you're going to get treated for it. And he said, no, I just want to find out. And we tested and we found it. And he said, okay. And he went home. And sometimes when you find something in muscle testing, it almost brings the body's awareness of it up, and you can become more sensitive. And So what ended up happening is he became more mercury sensitive, and he started becoming very nasty. His personality changed, and he called me up like, I don't know, a month later and said, I'm really nasty now, and all my staff quit because they couldn't handle me anymore. Pretty weird story, but again, don't look for anything you're not going to treat.
Great. Well, thank you all for joining us. We had a lot of fun. Hopefully you all learned some things. If you have any questions, my dad and I are both really easy to get a hold of. Shoot us an email or give us a call, and we would be happy to answer any questions or help in any way. I think the recording went well, so I'll send out a link if anyone wants to share.
We're going to try to do these things monthly. So if you guys have any topics you want covered, we will definitely consider it. You could stick it in the chat. You can send us an email. We're not going to talk about something we don't know anything about, but
yeah, please send us suggestions on anything. And we'd be happy, if you think a webinar would be good, we'd be happy to take any. And we would just need, honestly, to remember to schedule like a monthly one or something like that. And we'd be happy to help. So thank you all. And we look forward to hearing from you and chatting with you in the future.
Take care. Aloha.